My name is Pharmacist Michael, and this is the channel where we talk about living happy, healthy lives. Today, we're diving into something incredibly important, yet often misunderstood, and that is Ehlers-Danlos Syndrome, or EDS. Now, you might not have heard much about it, but if you or someone you know has ever dealt with flexible joints, skin that seems unusually stretchy, or chronic pain without a clear cause, this video is for you. Ehlers-Danlos syndrome is not just one condition, but actually a group of connective tissue disorders. Your body's connective tissue is made up of collagen, which you can think of as the glue that holds everything together. So, when collagen doesn't form properly, as it does in EDS, it can affect your skin, joints, blood vessels, and many other parts of your body, depending on the type of EDS you have. And there are about 13 different types. It can range from mild symptoms like flexible joints to more severe complications like fragile blood vessels. And because connective tissue is everywhere in the body, EDS can have a broad impact. So, what should you look out for if you suspect EDS? Here are some key signs. First, let's talk about joint hypermobility. Do your joints bend beyond the normal range of motion? People with EDS often experience joint dislocations and sprains far too easily. And while flexibility might sound like a superpower, it can actually be a source of constant pain and injury. Then there's skin hyperextensibility. In some forms of EDS, the skin can be stretchy, almost like elastic. It's soft, fragile, and may bruise easily or scar more than usual. And in the more severe forms, like vascular EDS, blood vessels can be fragile, leading to life-threatening internal bleeding. That's why it's so crucial to get diagnosed if you suspect EDS. Now, let's talk briefly about the different types of Ehlers-Danlos syndrome. The most common form is hypermobile EDS, or HEDS. This usually involves joint hypermobility, chronic pain, and dislocations. Then there's classical EDS, which features both joint and skin symptoms. Think stretchy skin and fragile tissue. One of the most dangerous forms is vascular EDS. This type impacts the blood vessels and organs, making them more prone to rupture. People with this type need close medical monitoring. There are also rare types, like kyphoscoliotic EDS, which affects the spine, and arthrochalasia EDS, where patients are born with dislocated hips. Each type requires a specific treatment plan, which is why proper diagnosis is so important. So, how do you diagnose EDS? Well, it can be tricky. Diagnosis often involves a combination of physical exams, genetic testing, and a detailed medical history. Many people go years before receiving a proper diagnosis, which is why awareness is key. Unfortunately, there's no cure for Ehlers-Danlos syndrome. However, the good news is that management is possible. Treatment is about controlling the symptoms and improving quality of life. This may include physical therapy to strengthen the muscles around the joints, medication for pain management, and in some cases, surgery. Physical therapy is one of the mainstays of treatment for those with hypermobile EDS. Strengthening the muscles around the joints can help prevent injuries. But it's important that therapists understand EDS and tailor exercises to avoid causing more damage. Living with EDS can be challenging, but it's not hopeless. Many people live full active lives by working closely with healthcare providers, learning to manage their symptoms, and staying connected with a support network. There are fantastic communities out there for people with EDS, From local support groups to online forums, you'll find that you're not alone on this journey. Raising awareness and sharing experience can make all the difference. So, whether you're dealing with Ehlers-Danlos syndrome or you know someone who is, remember that knowledge is power. The more we understand EDS, the better we can support those living with it. If you found this video helpful, please give it a thumbs up and share it with someone who might need this information. Don't forget to subscribe for more videos on health and wellness. And drop your questions in the comments below. Until next time, take care of your body and live your healthiest life. My name is Pharmacist Michael. I'll see you in the next video. Be happy and be healthy.